Hey guys, it's Dr. Cassidy here from T3 Chiropractic. So we are located in Rockwall, Texas. So we are committed to creating a healthy community here in Rockwall, Texas. Our goal is to make Rockwall, Texas one of the healthiest communities out there. So our focus at the office is these kids, and these kids starting in utero, in pregnancy. We really think it's really important to start there, and so we're going to explain that to you today in this presentation. So this is kind of what we're going to go over tonight. We're going to talk about a birth plan, how you should eat, how you should keep moving, you need to avoid toxins, a necessary test, how to build your team, the birth environment, and last but not least, your new baby. So the most important thing is having a plan. This requires careful planning and preparation. I tell people all the time, you can never just go out and run a marathon without preparing for it. You got to run, you got to eat right, you got to work up to it. And that's just the same thing with labor. You can't just, sit around on the couch, eat whatever you want, not take care of yourself, put toxins all over your body, just do whatever you want and expect to have a good labor. No, pregnancy is not a disease, it's not a diagnosis, it's not a condition. Don't treat it that way. Again, we got to plan for this. There's this website called mybirthplan.com. So it's extremely important to have a birth plan. On this website, and there's probably multiple websites, but this is a good website to kind of give you a basis of some of the things you need to go over. But in a birth plan, the most important thing is your birth team. You need to have your birth team's information and number, because I know you know who you want there, and if you want a chiropractor, if you stalled to come, I know you know that in your head. But during actual labor, you're not going to be thinking about that, you're not going to be talking about that, you're going to be focused on that baby. So you need everything written out, and there's a lot of things to actually think about. And so this mybirthplan.com kind of just gives you like check marks to use, and I think you need to use that as kind of a template, but you really need to make your own. You need to really visualize what you want the environment to be. Do you want dim lights? Do you want a birthing ball? All those things. Do you want to have a C-section? Do you not want to have a C-section? Do you want an epidural? Do you not want an epidural? I mean, all these things are really important because, again, when you're in labor, you can't think of these things. Who you want in the delivery room or in your room, wherever you're having a baby. That's really important. I'll tell you a funny story. I did not want my labors to be recorded or pictures. To me, it's just not what I want. It's a sacred place, and I just didn't want videos or pictures taking. And I still remember with my firstborn, my mother-in-law, love her to death, nothing wrong about it. She didn't even think about it. She didn't even read my birth plan, but she came in, recorded the whole thing. I had no clue. I mean, of course, I was focused on what I was doing. I had no clue. To this day, my son is 8 years old. I have yet to watch that, and I won't let anybody watch it. It's literally, I don't even know where it is. But again, if I had my birth plan out where she could see that, then it wouldn't have happened. It's not like she did it on purpose. It's just, again, I didn't have my birth plan where I needed it to be. It was actually on the refrigerator. She just didn't see it. And then on my second birth, me and my midwife had talked about my birth plan. She knew exactly what I wanted, so I didn't have it printed out at all. But I knew she would be there, so I knew she knew everything I wanted: delay, clamp cord, all those things that are important to me. Well, she did not make it. My labor went really fast and she didn't make it in time. 911 made it, and there were lots of discussions that didn't need to happen. There was a lot of freakouts. It was just a hot mess, but I'm telling you, you need to have a birth plan and you need to keep it with you. But again, going to that mybirthplan.com kind of will give you some guidelines on some of the questions you need to think about and what you need to be ready for during this birth process. All right, so let's prepare. If you do the homework, the test is easy. So this should be common sense, but you gotta eat right when you're pregnant. There's no such thing as eating for two, and what you eat is helping that baby grow. I tell people all the time, if you could just eat more God-made food instead of man-made food, life would be a lot better for you and your baby. You really need to emphasize on the proteins, eating good meat, eating, bone broth, all this stuff is really important. But again, if you get back to the basics of just eating what is God made and not man made, you are golden. But there are a couple of things that you do need to avoid. Raw fish is important. Alcohol is extremely important, and caffeine. I think caffeine was the hardest thing for me to give up during pregnancy, but I did. Processed meat, undercooked meats, raw sprouts, raw dairy, stuff in BPA, junk food, sugar, food calories. Again, we're not eating for two. You're not changing your diet. And, like I said, I've had 3 kids. I know, when you're not feeling good, you don't want to eat healthy, but this is just the start of it's not really about you anymore. It's about that baby and keeping them healthy and giving them the best start that he or she can have. I mean, that's when the whole baby is developing. So it's extremely important with what you eat. But also supplements, find a good prenatal. Vitamin is extremely, extremely important. I still have people that come in that think that they can still take the Flintstone vitamins for prenatal. I mean, that's just crazy to me. But some of the other supplements that you need to make sure that's in there is vitamin D, probiotic, omega-3, magnesium. And magnesium, I'm not even sure if I took this extra because I didn't really know about it, but after doing some research for this presentation, magnesium really helps with muscle relaxation, and it also prevents the uterus from contracting prematurely. So that's a really important supplement to add into your prenatals. And of course, keep moving, keep exercising. And I'm not telling you that you need to go do CrossFit if you've never done CrossFit, or don't do Camp Glider if you've never done it. I mean, if you've done it, keep on doing it. But you don't need to do something strenuous. You just need to get out there and walk. You have more energy. You can sleep better. You can manage your stress better. I mean, you don't gain as much weight. And then 80% of people that worked out gave birth on or before their due date. And it improves blood flow and oxygen to your baby's brain. So again, it's extremely important. And like I said, you don't have to go do something crazy. Go walk, do pelvic rocks, squats. I mean, squats are huge. I did squats every day, and I really truly believe it helped me get prepared for labor. Okay, this is a big one. And I probably shouldn't even say this out loud, but my whole thing with so many tongue ties and lip ties and all this that we're seeing in all these kids has to do with this whole folic acid and folate problem. So the difference between the two is folate is naturally found in foods. Folic acid is a supplemental form. So you need to get more folate, which you get from like liver, spinach. You need to get at least 400 to 600, sometimes even 800 to 1200. But anyways, so what the difference is folate can metabolize in your Krebs cycle. It's just how your body works. Folic acid has a hard time entering with the high doses, which leads to high levels of unmetabolized folic acid, which is unhealthy, which leads to cancers, which leads to anemia, which leads to neural tube defects. I mean, all kinds of problems. So it's really, really important to get the folate instead of the folic acid. And the tongue tie lip tie is definitely a neural tube defect. That's why I think it's all kind of related. But again, that is just me. I'm sure there's some studies out there, but I haven't really looked for them. But again, just making sure that you're getting the folate. Okay. So avoid toxins. So this website down below, the www.ewg.org, is extremely helpful. I search a lot of my stuff before I start using it, like my makeup, my lotions, my soaps and all that, just to see how toxic they are and give me options for less toxic things. Because again, what you put on your body goes through the umbilical cord and it affects that baby. You see it right here that in an umbilical cord there was over 287 chemicals, 180 carcinogens, 217 neurotoxins, 207 that cause birth defects. So I don't think people really understand, what you put on your body really affects you, and especially your unborn baby in your belly. So skip unnecessary tests. So this is what I tell people when they're always debating on if they should take a test. And so what is the purpose of the test? What are the risks that are involved for mom and baby? And how will the information influence the pregnancy? And what are the consequences for not having this test done? So the first one I want to talk about is ultrasounds. I did a 20-week ultrasound on all three of my kids. So I'm not saying ultrasounds are bad, and I know there's a time and a place. But again, we're talking about unnecessary tests. If there's a reason we need to do it, I totally agree. But, just to see the gender or see a cute picture of your baby, I'm not so sure those are necessary reasons to have an ultrasound. But let me explain to you why ultrasounds are bad. So there's 3 ways that ultrasounds affect body tissue. So the 3 are heat, cavitation, and acoustic streaming. So heat. So the ultrasound produces heat. And so there's a safe zone of heat of 1.8 to 4.5 degrees. But a continuous ultrasound is 2.5 to 10.4. So it almost doubles. So again, the heat can affect these babies. So each tissue raises it raises temperature differently. So bones heat faster than soft tissue. So you can see how the bones would be affected before the soft tissue. That's why it's real important to watch the temperature. And then the heat depends on exposure time and intensity of machine and the movement of the machine. I'm going to stop right there and tell you the story. So, all 3 kids, I told you we had the 20-week ultrasound. And the first 2, I was extremely anal about them getting in and getting out. And to constantly be moving because we did our research before we knew that those things were important. Well, then the 3rd child came out, and I had 2 boys first, and then the 3rd one I just knew it was a boy, because usually they are when you have 2 already a boy. And we found out it was a girl, and I was like in awe, and I was like making her check over and over and over, and my husband was like freaking out, like, gotta get out of there, I keep moving, again, because I was just so making sure it was a girl, and he knew from previous pregnancies how important it was to get in and get out and to keep that ultrasound moving. And so there was a study done in 1997 that the temperatures increased from ultrasound held for more than 30 seconds leads to heating of the organs. So again, got to keep that ultrasound moving the whole entire time. So again, the 3 things that affect or how the ultrasound affects you is heat, we just went over. The next thing is cavitation. So this cavitation happens where there's significant pockets of gas, so lungs and intestines. So obviously you do not want that to happen. And they've actually only done these tests on mammals. So obviously we can't do these tests on babies because we don't want them to die. But if it happens on mammals, we know it happens to us too. So the third and last reason why the ultrasounds we have to be careful with them is this acoustic streaming. And so what it is a jet of fluid created by ultrasound causing a shearing force on a cell. And so again, it pretty much just makes the cell become two. So we definitely don't want that. So here's a couple of studies that were done to show the safetyness of ultrasound. So one was done in 1996. It was actually almost 3,000 women in two groups. The first group had one ultrasound. The second group had 5. Group 2, the babies had shorter and smaller abdomen and arms. Then there was another study that was done on 72 children, and they were found that the children that had ultrasound had delayed speech and higher rate of ultrasound. And again, this is multiple ultrasounds. This is not just one. And again, the whole thing is to get in and out. And then studies have shown evidence that multiple pulsed wave ultrasound scans, or as few as 2 continuous wave scans, or any ultrasound by an unskilled operator is harmful. So it's important. You don't want to go to these places that just do it to just get a picture of a baby. You want to go to people that really know what they're doing. So when you're trying to make a decision on if you have ultrasounds, how many you have, just think of these things. Only do an ultrasound when medically indicated. Minimize the total exposure time. And minimize holding that ultrasound in one spot, and try not to do that in the first trimester. So the glucose test, I actually never had this done. I guess my midwife never really thought it was a big deal. And I think the reason why she never did it to me is because I never was high risk. You're high risk when you're older than 25. Or if you're overweight, or if you have a relative that has diabetes. So I totally get having a test like this if you're high risk. And there's other options if you do need to take this test. So kind of let me go over the whole glucose test. So normally when you eat carbs, it converts it to glucose in our body, and then our body releases insulin and pulls glucose out of the blood and puts it into our cells, and it's used for energy. But when you're pregnant, the insulin response is dampened, so more glucose in the blood so it can be transferred to the baby. So when our blood increases sugar levels, that's where we have hyperglycemia. That's why more pregnant women have it. So the problem is then it leads to a big baby. So when you have a big baby, you're worried about shoulder dystocia, jaundice, preeclampsia, but it does not cause death. Not saying we want any of these things. I'm just giving you all the facts so you can make sure you make your informed decision on if you want this test or not. But this whole glucola that you have to drink, it's actually banned from other countries. You can see this on the screen. The food dyes, it causes cancers. I mean, there's definitely, I don't want to even drink this when I'm not pregnant. I can only imagine when I'm pregnant. But the point of this test is to see really how your body can handle 50 grams of glucose in an hour. The problem with it is that it has a 76% sensitivity rate. So 24% test positive that don't have it. Another problem is if you take it at 28 weeks, you probably won't pass. If you take it at 24, you will pass. The day of the time matters. Like if you take it at 8 a.m., you'll probably pass. If you take it at 4 p.m., you won't. So there's a lot of characteristics that it's not very. There's no point of doing it, especially. Okay, there is point of doing this test. You just don't want to do it if you're not high risk, and we have other options. You can, because you can get false negatives or false positives, but the other options is to, in the first trimester, do a hemoglobin A1C test. Another option is have good diet. I think that's a great decision. And the third one is if you do want to test, there is a jelly bean test. You can actually take 20 jelly beans because they have 50 grams of sugar and do the test and not have to drink this glucose, the whatever it's called, the glucola. So again, I'm just giving you the information, and you make the decision that you want to make. And so there is another test that I wanted to go over, and it was the Group B test, because I actually tested positive with my first son, Tice, and it made me worry about it. But I want to kind of go over what it is and what I did, just so you know, so you won't freak out. So Group B test. So Group B is a common bacteria found in the digestive tract and the lower GI. It's actually found in 10 to 30% of pregnancies. So whenever a woman is tested positive, 51% of the babies do show signs and symptoms. 49% don't. So it's a wishy-washy if the kids will actually, if we don't do antibiotics, if the kids will actually have signs or symptoms. But if you do test positive, you might want to do the antibiotics if you have fever during labor, or if your water broke more than 18 hours during labor, or if it's a preterm birth. And then also, if you test positive, you want to make sure you don't do any vaginal exams. You avoid internal fetal monitoring and refuse membrane stripping. So some, like I told you, there are some alternatives. So like if you did test positive, like I did with my son, what I did is I ate lots of pickles, I ate lots of probiotic, I added in some apple cider vinegar. Those are the three things I did, and when it was time to come to labor, I didn't have it anymore. It didn't pass. I didn't have any problem with my child. And so other treatments is there is a chlorhexidine wash that kills the bacteria. And then your third option is IV antibiotics during labor. And the only problem with this is, giving your baby giving you antibiotics, and so your baby has these antibiotics. They get these little super bugs easy. It increases the risk of asthma and allergies, increases yeast infection, increases blood infection. So there's a lot of, you just got to really think about it and just make a really good, educated decision. So those are the unnecessary treatments. So the next thing is build your dream team. So doulas is pretty much a coach during labor. I think this is really important, especially if you have a husband that doesn't really know your plan or is not strong. I know most men are. My husband was very strong. I didn't have a doula, but if you just feel like you need a little bit of support, doulas are great. Midwives are great. I love my midwife. I still talk to her pretty frequently. They actually now in some local hospitals they have midwives that have that philosophy to get you through a happy and healthy and normal pregnancy. And of course, a chiropractor. I mean, if you have a well-balanced pelvis, that you're going to have an easier birth. Shorter labor, and prevention of unnecessary C-sections. And you can see these pictures here. So you can see on the left a normal spine, and then you can see how the pressure is put on the lower lumbars as that belly grows. And then so birth is hard, obviously, but even if you have a misaligned pelvis, it's going to be just a little bit harder, because the three main causes of a difficult labor are muscle contractions. The muscle literally cannot contract, of course. How do you get a muscle to contract? It's that nerve impulse to that muscle. So again, if you have pressure on that low back, then you know those nerves are not firing to those muscles. Poor alignment of the pelvis, poor alignment of the baby. So all these things that chiropractic can help. Chiropractic helps with faster labor, optimal fetal position, and brain development on that baby. Breech baby. So I am certified as Webster Technique. And so that's important if you do have a breech baby. But I just want to make it clear, I do not turn babies. I get the body in the proper alignment so that baby can turn on his own. So yes, we want to make sure that the pelvis is in the correct alignment so that baby can come out easier. But one of the most important things is to make sure that your body's not in that constant sympathetic, that fight or flight. You might have learned this in middle school, like if a bear came up to your campsite, you would be in constant sympathetic. That's normal, but it's not normal to constantly be in sympathetic, and unfortunately that's kind of the state that we're in. And if you're in constant sympathetic, then your baby's in constant sympathetic. And so that's why it's really important to get adjusted while you're pregnancy, not only for posture, for correct pelvis alignment, but just to make sure that you're not in constant sympathetic so your baby is not in constant sympathetic. And at our office, we don't guess, we test. And so we have a thermal, we have segmental, and we have your heart rate. So the thermal is, testing those nerves. Definitely in that low back, you want to make sure those nerves are firing to all your female parts so you can have an easier birth. Low back, we want to make sure that those nerves that are firing to your muscles are working at 100%. And last but not least, your heart rate, your skin conductance, all those things, we put it together just to make sure that you're not in that constant sympathetic. Again, if you're in constant sympathetic, your body can't heal. Your body's not healing, your baby's not healing, your baby's not growing. So, extremely important to have these tests done, or find a chiropractor that has these tests. If you're watching this somewhere else, just send us a quick email with a zip code. We can find you somebody. And so we've talked about this multiple times, but benefits of chiropractic care during pregnancy: faster labor, better position for these babies, less uterine constraint, enhanced baby's brain development. So, and again, less nausea, less heartburn, less constipation, less back pain. I mean, the list just keeps going on and on. But research has shown that 25% faster labor times in the first-time mothers who got chiropractic care throughout the pregnancies, 39% in women with multiple pregnancy. Who doesn't want that? So birth environment. Birth environment is so important. I don't tell a lot of people that I have my babies at home just because everybody thinks you're crazy. But I honestly have my babies at home because I have a fear of the hospital. I would have so much anxiety if I had my baby at the hospital. If you have so much anxiety to have your baby at home, have it at the hospital. The birth environment is your environment, and you've got to choose that. So, but studies have shown 85% of women that that have their baby in the hospitals have intervention that could be prevented. And I'm not gonna lie, I tell people all the time, if I had my babies at the hospital, I probably would have an epidural, because it's not an easy thing. Again, it's a marathon. You have to work really hard at it. But if you are going to have it at at a hospital, you definitely need to have a birth plan. You need to look into your hospital C-section rate. You need to be able to choose the position you give birth in. All these things that are important with you, you need to find that hospital, that specific hospital that will do all that for you. And at home, unfortunately, we are treating pregnancy as disease. I don't think it's a disease, so I have no problem having my baby at home, especially if I'm low risk and I don't have any complications. With having a baby at home, if there's problems, it's usually found before you actually go into labor. And I again, want to definitely not have any interventions. And like I told you before, probably if I had it at the hospital, I'd have an epidural. It is hard work. So, stress levels. You want to keep the stress levels low. It's already going to be pretty stressful for yourself, so make sure you can do anything and everything to make it less stressful. Make a playlist. Have calming lighting, have essential oils going. And we do have a birth class at our office often. So check our website or check their website to find more information on these birth classes to learn more. But, getting a tub, getting a big ball to sit on, there's multiple things that you can do to help with your pregnancy or help with your labor. And then again, if you have a calm pregnancy, you have a calm birth, you have a calm baby. So just remember that. So these are a couple of hard things to go over. And these are things that you really need to educate yourself, ask the right questions, read the right books to get this information. Will you vaccinate? Will you circumcise? Will you do encapsulation? All these things are really, really important. But also delayed bath, delayed cord clamping, skin to skin, and obviously getting that baby checked by a chiropractor. But why it's important to do skin to skin? Milk supply promotes healthy weight gain. Baby's mental development makes breastfeeding easier, improves sleep, prevents postpartum depression, baby stress and pain, decrease baby's stress and pain. Now they're doing it where you put the baby on the mommy's tummy and you just let that baby crawl up to your breast. That's pretty stinking amazing. It's pretty amazing that body's innate to know, I got to climb up there and get some milk. It's pretty amazing. So this is a hard thing to go over, and this is a hard picture for me to always look at. Because no matter if you have a C-section or if you have your baby naturally, most of the time they do pull on that neck. And so just imagine holding your baby up by the neck. It's not going to be good. The studies have shown that 60 to 90 pounds of pressure during normal birth. So do you see why it's important to get these babies adjusted? I mean, their nervous system controls everything in their body, and so we want them to have the best start of life that they can get. So this is a huge reason to get these babies checked. There was a study published in the Chiropractic Research Journal that compared the health and wellness of 200 children under chiropractic care and 200 under conventional medical care. The chiropractic group had fewer ear infection, fewer allergies, fewer tonsillitis and asthma. They were just healthier. But again, it's not really what chiropractic does. It's letting that body heal from a pretty traumatic birth. Every step you take towards a healthy and stress-free pregnancy will lead to an easier birth, a calmer baby, and a better recovery. Everything you do during pregnancy is important. Everything you do during labor is important. But most importantly, you were created to do this, and you can do this. So I just want to invite all of you that are not patients that are watching this to please call our office, and we can give you that discounted exam. Just let us know that you watched our pregnancy webinar, and I'm so thankful that all of you joined us. We are T3 Chiropractic. We are creating a healthy community, one family at a time.